Thank you. Professor Shalin Kumar, Acting Director and Dean of our Institute. Uh, the invited experts and speakers for today's symposium on academic surgical practice, Professor V.K. Kapoor, Professor Sanjay Bihari, Professor Bijo Putakat, Professor A.K. Verma, our senior faculty colleague, uh, officers and faculty members of various other departments of the Institute, alumni of our department, both those who are here in the auditorium today, as well as those who have joined us virtually through the Zoom platform, faculty colleagues, residents, nursing and paramedical staff, office personnel, support staff, and other people working in the department. Ladies and gentlemen, I welcome you all to this 35th Foundation Day function of our department and the Symposium on Academic Surgical Practice. The year that has gone by has been quite an eventful one for us. And I would like to present to you a brief report of the activities and the happenings of the department during this past year. But before that, for the kind information of some of the new members in the audience and the guests, our department was started, as has been introduced to you, by Professor Dhiman and Professor Anjali Mishra. We started in 1989 with the joining of our first faculty member, Professor S.K. Mishra. Since that time, with help from numerous directors, deans, administration of the institute, the government of Uttar Pradesh, as well as with assistance from various other institutions within the country and abroad, our department has been able to establish itself as a leader in endocrine and breast surgical teaching and training, practice and research globally. We were the first academic department to start in the country, so we did have the first mover advantage. We also started the first PDCC program in endocrine surgery way back in 1997. Subsequently, we also started, after due approval from the Medical Council of India, the first MCH course in the country in 2004. And only recently, we have now started a PDCC course in breast surgery, as recently as 2020. So our department has been evolving itself with needs of the time. Owing to the untiring efforts of the past and the current faculty members, and the support of we have received from peers from various other institutions, both Indian and international institutions, and the successive directors and deans of the institute, the department is now counted amongst the best training centers globally in the fields of endocrine surgery and breast surgery. I joined this department as a senior resident in 1994. And in these 3 decades I've been here, I have witnessed its growth and development firsthand. And I think I can say with some confidence that we have come up to this expectation of our institute and our peers in establishing a good quality teaching, training, and surgical practice center. So I'll now be presenting a brief report of the activities and achievements of the department during the year which has gone by, which has brought some of the most unprecedented challenges for us. It gives me great satisfaction to report that there has been an overall qualitative as well as quantitative growth in our activities and improvement in all spheres of our working in the department. In the past year, the department has witnessed a number of significant events and achievements, some of which I'll like to share with you. This past year, the department witnessed an unprecedented challenge in form of a tragic fire accident in the main operation theater complex of our institute, which happened on 18th of December 2023. It was a major fire, as I witnessed it firsthand. It could have engulfed and inundated the entire hospital, but for the commitment and courage of those who were there, both our hospital staff as well as the firefighting team. faculty, residents, nurses, technicians, support staff, Safai Karmcharis of various departments, they did not care for their own safety. They worked selflessly to salvage whatever could be. There were at least 100 patients in that OT ICU complex. And while it is satisfying that majority or almost all of them could be saved, thanks to the effort of all the staff, sadly, we lost one life. One patient being operated in one of our operation theaters could not be salvaged. And we condole that death wholeheartedly. I also like to take this opportunity to thank and acknowledge all the courageous efforts by all of you. Majority of them are sitting in this auditorium today, for your efforts, for your selfless service, which could salvage the lives of so many. Equally, this unprecedented challenge could have stalled our work forever or for at least a very long period of time. But entirely due to the resolve and commitment of my faculty colleagues, the residents, the nurses, and all other staff, within a short span of less than 2 weeks, we were up and running. All my colleagues and residents, everyone, overcoming their grief and their trauma, they bounced back very quickly, and we could, as I said, start our operative work also within a very short span of time. And I would like to thank the institute administration, the hospital administration, various other surgical departments, Department of Anesthesiology, for all the help they extended to us. And we could start our operative services with loaned or borrowed equipment and instruments and various infrastructures. And we are now back to a functional department. Well, that was not the only challenge we faced. In this year, we are currently just 4 faculty members, down from 8 at one time. Many of our senior colleagues have retired. Some of our bond assistant professors or contractual ones have finished their bond career tenures and moved on. But there seems to be some light at the end of this tunnel. After a very long hiatus, the process of appointments or recruitment of permanent faculty, as also some contractual faculty, has been started, and we hope at least some of them would join very soon. We've also been able to achieve full activation of both our new wards. As some of you who have been in the department or have been aware of the department's activities, we were allotted 2 wards or additional 30 beds in November 2022, and gradually from being just 34 beds department, we went on to activate 52 last year, and now we have fully functional 60 beds, in addition to the 10 beds that we utilize in the daycare ward. The Advanced Diabetes Center of the Institute is just around the corner, to be inaugurated very soon, and we would have to shoulder the responsibilities of running the diabetes foot unit in that Advanced Diabetes Center. That will come with additional burden or additional opportunities for our department. But of course, we will be able to do all that only when we have more manpower and infrastructure. The 2 units of the department are currently functioning from the ground floor ward and the 3rd floor ward. But the renovation work of the 3rd floor A side ward is progressing at a fast pace, and we expect that this will be completed over next 3 to 6 months, and we will be able to shift our ground floor ward to the 3rd floor, which will give us a lot of respite. It will help us by consolidating our clinical activities on one floor, which are currently split in 2 different floors. In the recent few years, we have augmented the strength of our nursing personnel, technicians, and other support staff in various areas of the department. We are still awaiting activation of our 3rd major OT, which was sanctioned to us in late 2022. But of course, owing to various reasons, we have still not been able to start that. I hope that in the current year, we'll be able to start that. The process of reconstruction and equipping of our major OTs in the main OT complex, which were destroyed in the fire accident, is well underway. And we hope that we'll be able to complete this whole process in next 3 to 6 months. Currently, we are functioning out of 2 OTs, which have been given to us in the robotic surgery complex, and also from the minor OT, which is there in the OPD building. 2 of our assistant professors who completed their bond tenures, they have moved out, Drs. Fareen Khan and Dr. Sushobhan Pradhan. 4 of our MCS students have completed their tenure in the recent year. Couple of our senior members of the department, Mr. Fanish Mani Tripathi, who retired as assistant additional nursing superintendent, and Mr. M.S. Siddiqui, who retired as AAO, are thankfully here in the audience today. And thank you for joining us today. We also had one overseas fellow from Nigeria who completed his one-year fellowship here during this past year. We've continued with our quest for improving and following good administrative and governance practices. We have been working with the mantra of shared decision-making and shared responsibilities. Various faculty members are shouldering responsibilities in various areas in the department. And then our practice of, or our resolve to have equal rights, equal opportunities, equal responsibilities for all has worked very well so far for us. Some of our recent initiatives to improve the quality and satisfaction of all stakeholders are bearing fruit. We have completed the process of competence-based curricular development, both for our MCH endocrine surgery course and for the PDCC breast surgery course. These have been approved by the Institute Academic Board and have now been submitted to the National Medical Commission for being included as a model curriculum, which unfortunately continues to be pending. And we have been using our unique objective academic performance attendance monitoring system in our teaching and training activities. Let me now share some glimpses of some of our clinical practices and services. We practice a whole spectrum of endocrine surgery and breast surgery, and we are able to do that only with active and supportive collaboration from various other disciplines, most importantly from our sister departments of endocrinology, anesthesiology, radiation oncology, medical oncology, nuclear medicine, as also from the various diagnostic departments, radiology, pathology, etc. We made more and more of our patients in recent time have been supported by various governmental financial support schemes, the PMJAY Ayushman Bharat scheme, the Pandit Deen Dayal Upadhyay scheme for cashless treatment of government employees, the Chief Minister of Prime Minister's discretionary fund, and many others. In terms of quantitative growth, again, it's satisfying that in majority of spheres or areas that we work, we have seen approximately 10% growth in patient numbers. It's not surprising that the total new registrations in the OPD have grown by about 10% in the last year. Similarly, patients whom we have followed up following their initial treatment has also grown by about 10%. In terms of number of admissions to the ward, once again, we have seen about 10% growth in numbers. In terms of number of operative procedures performed, however, we have lagged behind slightly, and it's entirely because of the disruptions in our operative services, firstly due to the fire accident, and recently due to the work boycott by our residents who boycotted work in solidarity with doctors striking all over the country to protest against the ghastly and tragic rape and murder of a resident doctor in Kolkata. But we are quite hopeful that we'll still touch very close number as the previous years. Very briefly, of the various key clinical areas where we function, in terms of number of benign thyroid diseases which we have treated, we have gained some numbers, but it is with management of thyroid cancers, more so patients who have required complex reoperations or extensive surgeries for locally advanced cancers, we have seen a quantum jump in numbers. Similarly, patients who have required parathyroidectomy for primary or secondary hyperparathyroidism, parathyroid tumors, there's been about one-third increase in numbers. The same is true for patients requiring adrenal surgery for adenocortical or pheochromocytoma and parenchyma surgeries, where the numbers have increased. Patients presenting with various benign breast conditions, the numbers have increased about 15%, and so have the numbers of patients who have received care for breast cancer. And I must mention here, comprehensive breast cancer care is one of the areas where majority of our department resources are utilized to the fullest. In collaboration and with help from our multidisciplinary team, primarily from Department of Radiotherapy, Medical Oncology, we are able to provide comprehensive care, high quality comprehensive care to breast cancer patients, and the numbers are only increasing. One perplexing fact about the last year's practice has been an almost threefold increase in numbers of patients who have required care for diabetic foot ulcers and diabetic foot problems. And this is even before we have started the Advanced Diabetes Center. And it is indeed both a challenge and an opportunity for us in the coming years to build on this strength and be able to offer good care to our diabetes foot patients and also embark on some teaching, training, and research activities in this area. While quantitative growth is satisfying, but what is even more satisfying to all of us in the department is that we are able to offer state-of-art, high-quality care in various areas of our functioning. And some of the key areas where we can boast or find satisfaction is things like oncoplastic breast surgery, as the Dean mentioned, where we are considered as forerunners and pioneers. Robotic and endoscopic thyroid and parathyroid surgery, minimally invasive endocrine surgery, sentinel lymph node biopsies, and utilization of high technology, currently contemporary technologies in the care of our patients. Minimally invasive endocrine surgery is an area of focus and which has been there for at least 2 decades now. We were pioneers in the country for adopting laparoscopic adrenal surgery, endoscopic thyroid surgery, but more recently, we've been able to do robotic endocrine surgical procedures, mostly for thyroid, various thyroid pathologies, but also for various other indications too. And here you see some glimpses of whole spectrum of complex and high technology procedures that are required for various thyroid pathologies. And as I said earlier, oncoplastic breast surgery has been another area where we've been able to make some difference. We are considered as a center of excellence for oncoplastic surgery, and we receive numerous requests from various quarters for training opportunities in this area. And this year, the theme of our presentation in the institutional clinical grand round was oncoplastic breast surgery. And I think the audience appreciated that experience very well. In terms of our teaching and training activities, we continue to have our structured and mentored teaching and training activity. Each resident, each trainee in the department, both the MCH students as well as PDCC breast surgery students, they're mentored and supervised by a designated faculty supervisor. Everyone undergoes this comprehensive academic and training program covering all facets of endocrine and breast surgery. We have in place a well-established monitoring system where residents' performances are monitored using both the review of their logbooks as well as midterm and preparatory examinations. Currently, we have 10 MCH students in the department and 2 PDCC breast surgery students. One scholar is pursuing PhD in the department, and we have had one overseas and two national short-term to medium-term fellows who have completed their trainings in the department recently. The department has been conducting numerous workshops, CMEs, and training programs, both at regional and national level. And here you see some glimpses of some of these training programs which we have undertaken, which attracted experts as well as delegates and trainees from various institutions in the country and abroad. On research front, we currently have 7 intramural and 4 extramural projects which are going on with a total grant of approximately 2.2 crores. There have been more than 600 publications till date in the department. And during the year, this past year, our faculty and residents have published 26 peer-reviewed publications and 6 book chapters. It humbles me to say that many of our publications are highly cited, and I myself have been fortunate to have more than 9,000 citations and an H index of 48. And as the director kindly told in his address, that I've been fortunate to feature in the world's top 2% cited scientists for the 3rd year running. And our faculty colleagues and residents have delivered more than 50 invited lectures, talks, and orations, and they're very highly sought after faculty and experts for conducting workshops on national as well as international level. So many of our department members have received awards and accolades and recognitions, and this includes right from our support staff who have been acknowledged for their exemplary service to the institute. Mr. M.S. Siddiqui has been awarded on 26 January, and recently Mrs. Meera Srivastav, the Chief Technical Officer, was awarded on 15th of August. Many of our residents have received Best Paper Awards, travel bursaries, and travel awards in various international and national conferences. And also many of us faculty members have received a few awards and recognitions for their outstanding services. Outreach programs and health awareness have been another focus area for us over many decades. And in this past year too, approximately 20 breast cancer awareness programs have been conducted by our department members in various places in and around Lucknow. And we have reached out to at least 20,000 women directly and many more indirectly to these outreach programs. In the end, we have been enjoying quite a camaraderie and kinship in the department, because we all believe that a department which celebrates together grows together. We have had numerous social and other kind of gatherings. We try and utilize each of these opportunities to enjoy together in each other's company. And I would like to thank all the department colleagues, all the members in the department for this camaraderie and good working atmosphere in the department. In the end, I would like to thank the director, the dean, the institute and the hospital administration, the collaborative departments, all members of the faculty of the institute and of my department, the residents, nurses, office staff, other staff of the department for their continued support and assistance for me and for all of us in the department to carry on with our path of growth and progress. And I thank you all also for this patient hearing and for kindly coming over here to share this occasion of joy with all of us. Thank you very much. As some of you may probably have noticed, especially our alumni, that each foundation year we used to have one endocrine surgery foundation day oration. However, this year, departing from that tradition, we have, and the reason why we have departed from that tradition is that we're going to have that foundation day oration and our alumni function in about 10 days from now. And that's because the National Conference of Indian Association of Endocrine Surgeons is going to be held in Lucknow from 19th to 21st. We're going to have major international visitors, and one of those, Professor Tran Yang Du, Chief of Endocrine Surgery at UCSF, California, would deliver this Endocrine Surgery Foundation Day oration on 19th. And I request all of you again to please attend that oration. It's going to be of interest to all of you. But today, instead, guided by the director, Professor Human, we thought we would organize a symposium which may be of interest to not just endocrine surgeons, but surgeons in general and academicians as a whole. And I request my colleague, Dr. Sabaratnam, to introduce this concept of symposium on academic surgical practice. Thank you.